on replacement of disposable PPE with washable PPE to reduce waste. It will be Sister Arcelita Saranila from SPC. The floor is yours. Thank you.
Okay. So, good morning and peace be with you. It's an honor to be here. And in behalf of St. Paul's Hospital of Iloilo, I wish to express our sincere gratitude to WHO, the Global Climate and Health Alliance, for having selected our case study among the presentations in today's event. Next study. So the title of our study is The Replacement of Disposable PPE with Washable PPE to Reduce Waste, a project achieved by our frontliners. I have placed a project cost of 1 million pesos to anticipate the cost of replenishment. It's more than a year now, and we need to change some of the PPEs already. Next slide, please. Next slide. Amidst the pandemic, we continue to pursue Pope Francis Laudato Si and take initiatives to mitigate climate change. Among the key steps taken by SPHI are the following: intensive segregation of waste, the use of reusable, washable PPEs, autoclaving of infectious waste instead of incinerating them, and ozonization of wastewater and recycling of gray water. Next slide, please. Next slide, please. So the implementation of this project is that we customize our reusable PPEs, considering the high cost of PPE, so we produce our own reusable PPEs stitched by our linen staff at the hospital. Also, to address the scarcity of supplies, we insert surgical masks inside the customized washable cloth mask and change it weekly. Next slide, please. This is the finished product, including the head cap and the PPE. And in doffing the PPEs, we provided designated receptacle for the head cap, the gown, and the goggles, as you can see in the slide below. Next slide, please. And the reprocessing of the PPEs are decontaminated by spraying with 10% sodium hypochlorite before being brought to the laundry area. At the laundry area, these are placed in a tub with 10% sodium hypochlorite plus detergent soap and water. And these are rinsed with water twice. And the PPEs are let dry under sunlight and air. As you know, the Philippines we have abundant sunlight, and we reprocess a minimum of 300 sets of PPE every day. And the ready set of PPE is packed together in a cloth pouch, which is also stitched by our linen staff. Next slide, please. Among the progress achieved, had we not shifted to washable PPE, we could have spent 64.8 million pesos, but we only had a one-time expense of 650,000, generating savings of 64,150,000 pesos. By the way, the project, the case study that we have presented, we only have a period of April to December, but it is still ongoing up to the present. As regards, the next slide, please. As regards the disposal of the medical waste, since we did not use disposable PPEs, we also saved in the collection of infectious waste. It's a savings of 1.2 million. Next slide, please. Among the challenges encountered were the difficulty in sourcing the washable PPE from local suppliers during early stage of the pandemic. And of course, until now is ongoing. We need to ask for the supplier to reserve the supplies for us. Also, some resistance from the staff and doctors at the start of the implementation because they've been so used to the disposable PPEs. But we also realized the impact on the environment and the disposal of medical and infectious waste. Now, the lessons. Next slide, please. Lessons learned is that the replacement of disposable PPEs with the washable PPEs has been beneficial to the hospital, not only for the reduction in medical waste, but also for saving hospital budget, as mentioned earlier. And the savings can be redirected to other pandemic response initiatives like the sanitizing agents and some other supplies that we need to protect our healthcare workers. And the third is the exercise of a political will to pursue, please, exercise a political will to pursue the project with proper communication to the stakeholders. Step forward. So SPHI shall continue to reassess its systems and procedures on how we can minimize the volume of medical waste to mitigate harmful effects in the environment while observing the safety of its healthcare workers. Also, the hospital will influence other healthcare institutions on the use of reusable PPEs for sustainability and environmental care. We have shared to others, members of our healthcare system as regards the use of disposable PPEs, including the reprocessing method. Next slide, please. Thank you, and God bless us all.